This is Dr. Shaminique Bodie Williams, a consultant in the Grand Bahama Health Services. So, now I'm pregnant. What testing should I expect in my first part of the pregnancy? Congratulations! Being pregnant is exciting for many. And once you've gotten your pregnancy test and you've booked your appointment to see your nearest clinic, there are some routine tests that may be done on every pregnant patient, and they have different reasons behind the testing. Some of the testing in the first trimester may include that we may check your hemoglobin levels to make sure the ability of the red cells in your body have the potential to deliver oxygen to you and the baby. We want to make sure that this level is sufficient. In addition to that, in the event that you are anemic or have low blood, we may request that you add some additional iron to increase that number. We would also want to know your blood group and your rhesus type. So as a reminder, there are 4 main blood types: A, B, and O. And your rhesus type can either be negative or positive. And this refers to a particular protein that's on the red blood cells known as the rhesus antigen. If your baby carries this protein, but you do not, meaning that you are rhesus negative, then it may mean that other proteins in your body may attack the baby's blood cells, causing low blood in the baby. And if this is severe, it may even cause your baby's heart to fail. So in that case, we would use medication named RhoGAM to help prevent this in your pregnancy. So it is important to know your blood type. We also encourage you to be screened for sexually transmitted infections such as HIV, syphilis, chlamydia, gonorrhea, as some of these infections may have devastating effects on the fetus if they are left undetected and untreated. We also will usually check your urine, and we're checking for urinary tract infections, which are more common in pregnancy and can be easily treated. We will also look to see that your immunizations are up to date, including your rubella. And this makes sure that you have enough protection against rubella in the event that you are exposed to this community illness during your pregnancy. We use a pap test to ensure that the cells on the neck of the womb are normal. And sometimes this is done before you are pregnant, during the pregnancy, and in some cases after the pregnancy. We also check for other infections, such as hepatitis B, which is a sexually transmitted or waterborne infection that can be passed to the fetus and the womb. If you are found to be positive, this is important because treatment is given to the baby at the time of delivery. In addition to that, we are also not just using laboratory values, but we are also taking the time at visits to talk with you and to see how your weight and your blood pressure are. So it is important to make sure that you make your antenatal visits, as they are important labs that are done along the way to ensure an excellent outcome.